as we really delve into the conversation, a lot of men want to know, is there a safe way that I can get a bigger penis? And so part of that discussion, and I actually have this in my erectile dysfunction packet, which is about 18 pages. I have a page on Restorex because even if I don't have a nuanced discussion about this device with every single person presenting with ED, I think every person with ED should know about it so that 5 years down the line, they don't come back in and say, I wish someone had told me.
Mhm.
So, in that way, maybe it does potentially play a role for any man, and we just have to manage those expectations and simply say, we currently don't have research on it, but it may help.
I think on the doctor side, you're a lot more free than you are on like a medical device
Mhm.
company side type things. And because on a doctor side, you're always trying to take all the data and just say, would it make sense in this population? Would it make sense in that population type thing? And so generally, if something works in a much more difficult situation, then usually it's kind of assumed that okay, this is going to work in an easy. When you look at most companies, the way they design studies, they try to cherry pick, and you try to get the perfect population where you know this is going to work. And so you have a lot of inclusion exclusion type criteria. And in this case, we went the complete opposite, where we said, let's take all comers, hardest situations, let's see what happens and see what this thing can do or not. Um, and then from a patient standpoint, I think, and I imagine you and I are similar in this way in that I just start with what are you seeking to accomplish? Because a lot of times someone may come in and it may say erectile dysfunction or something like that, but in reality, they want their relationship to be better, or they want their ejaculatory latency time to be longer. Or so I think until you drill it really down to what do you really, really want, because someone may come in and say, well, I want more length, but in reality, they're saying, I want to please a partner more, or I'm worried about this anxiety or something like that. And no device is going to fix that. And so it comes down to what is their problem and can the thing address it? And if so, then great, this is a good match.
Mhm.